Good morning. I'd like to address a couple of topics today. First, an update on COVID-19. Reported cases of COVID in St. Louis County are relatively low, but they appear to have plateaued. And it's particularly encouraging that our hospital admissions for COVID are at some of the lowest level they've been since the beginning of the pandemic. The county's positivity rate is 3.4%, and we're averaging about 50 new cases per day. Under the CDC's new community risk level, we're in a low-risk category. We're hopeful that these numbers remain low. However, public health experts across the country, including here in St. Louis, are closely following a concerning trend in Europe. Many European countries, the United Kingdom, for example, have seen an increase in cases of COVID in the past couple of weeks. The latest surge in Europe has been attributed to a subvariant of Omicron called BA2. The BA2 subvariant has been detected in Missouri by the state's sewer shed surveillance program, and the state has confirmed that some cases of COVID-19 in St. Louis County have been caused by this subvariant. Both the Delta and Omicron variants hit countries in Europe first, and we followed them 4 to 6 weeks later. As such, we are monitoring this latest surge in Europe and need to be prepared if cases begin to rise again here in St. Louis. Here's what we know about the BA2 variant so far. Early indicators show that it's more transmissible than Omicron. However, vaccination and prior infection with Omicron do seem to be protective against this new subvariant. Vaccinations are the single greatest source of protection against severe illness and hospitalization. Our data show that those who got the vaccine were much less likely to be hospitalized than those who didn't. And even if you did get sick with COVID, the vaccination offered further protection against future infections. In St. Louis County, 75% of our residents have had at least one dose of the vaccine, and 63% are fully vaccinated. While those rates lead the state, there are many people, particularly our young children, who have not yet gotten their first dose. And we don't know whether BA2 will cause another wave in the St. Louis region, but we do know existing vaccines work to reduce the risk of severe illness from this new BA2 subvariant. As we enjoy this period of relatively few cases, please take advantage of this time to make sure you're prepared for any potential future surges. You can order a free at-home test from covettest.gov. And don't toss those masks just yet. Hold on to them in the event cases begin to increase again. Our public health experts will continue to monitor the situation, and I'll keep you all updated with any further information. I'd also like to talk this morning about the local fallout from the war in Ukraine. The suffering in Ukraine is heartbreaking. It's great to see our country's outpouring of support. And while the conflict is more than 5,000 miles away, we're seeing the impact of the war here with disruptions in our life. The spike in gas prices at the pump is something we've all felt, but as President Biden warned on Monday, cyber attacks will also be a disruption. While governments can work to protect from cyber attacks, they cannot defend against all attempts at illegal tapping into personal records, bank accounts, or proprietary information about a company and the way it does business. In St. Louis County, our IT department is closely monitoring our system, blocking access from countries where the cyber attacks are most likely. Our IT experts say the best way to avoid getting hacked is to pay attention to emails that you receive. And if you get an email from someone you don't know and it contains a link, don't open it. And if it's a work email address, report it to your IT department. If you receive an email from someone you know and it contains a link you were not expecting, don't open it. Not until you've talked to the person who sent it to see if it's something they intended or it's a hacking attempt. This is the most common way hackers are able to do their damage, stealing money and data. Finally, a thank you to everyone who participated in our town halls, providing your thoughts on how the county should spend more than $80 million for the American Recovery Plan Act funds. Our 7th and final town hall meeting is tonight from 6 to 8 p.m. at the Thornhill branch of the St. Louis County Public Library. An online survey is also seeking resident input, and that closes this Friday, March 25th. So far, we've had over 2,600 surveys submitted. We have the opportunity to make transformational changes in St. Louis County with these federal funds, so it's great to see so many residents joining in the process. Every voice matters. Thank you for your input, and I'd be glad to answer any questions.
Well, the first thing I just want to ask you about, Dr. Page, is just about, you spoke about the BA variant. You told us to hold on to our masks. What's your preparation plans there? If we see a surge, could we see mandates come back or restrictions? What's your mindset?
So the question is about the BA2 variant and the thought process about holding on to your masks. I think that we still see people wearing masks in the community because they're comfortable wearing a mask and they choose to wear a mask. And if the cases start to increase again, I expect to see more people making that choice. For us to have any more mandates in the future, for us to do that, we would have to see a significant surge that looked a lot like what we've seen in the past. And right now we don't expect that, but we do expect cases to go up in the coming weeks.
What's the percentage that kind of catches your eye that would pin those restrictions?
Well, the CDC just changed their guidelines to not only look at cases, but also the rate of hospital admissions and the number of hospitalizations that are due to COVID. And then some of that is ICU admissions. So we would look to the CDC as they modify their restrictions and talk to the folks in the pandemic task force and the public health department before we could give you any numbers. Those cases and the tolerance for cases and the tolerance for stress on the hospital has increased some as we've gotten better at taking care of patients. And I also think that the case rate is less of a driver as more people get vaccinated. So there's a lot of variables that go into that decision.
Thank you. I want to jump to your survey. With your survey, do you have like a trend that you've been seeing, what people want to see happen with those federal funds?
Yeah, so the question is about what feedback we've been getting from our community on our surveys. We haven't studied the surveys yet. Our outside group will process those and tabulate the data and help us understand what that data means. We have gotten feedback from our town halls that gives us a little bit of insight into what people are talking about, and they're talking about infrastructure improvements. We heard a lot in South County about the need for infrastructure and the need for attention to our unincorporated areas of the county that don't have a municipal government taking care of their needs. And I do think that St. Louis County has a special obligation to our unincorporated areas that aren't in a municipality. We've heard folks at our town hall meetings talk about public safety. We've heard them talk about access to public health. We've heard them talk about improvements at some of our closed malls like Jamestown Mall. And there's a wide variety of feedback from our town halls. I think it's been a good conversation, and we'll hear more at our last town hall tonight.
And last question for me, I know we've talked a lot about once you have that deadline on Friday, what's kind of like the timeline once you start sifting through those processes and those surveys that you have that you are going to start allocating money towards that type of stuff?
So the question is two parts. One is what's the timeline to crunch the data from the surveys, and the second is the timeline to make decisions about ARPA spending. It'll take us at least a couple of weeks to tabulate those surveys. It's not like a standardized test where we just run it through the computer and get a grade. These surveys have a lot of open-ended questions, and if there's 2,600 or 2,800 or 3,000 responses, then we're going to have to evaluate those open-ended questions and categorize those answers and understand them. The ARPA funds are required by federal law to be spent in the first 3 years, or to be appropriated in the first 3 years and spent in the first 5. So we have some time. This isn't an emergency like it was with the CARES Act funding, where we only had a few months to get the money into the community, or we had to send it back to the federal government. So we've got some time to be thoughtful about this. We don't know what the future holds in the way of public health challenges or future wave of COVID, so we'll probably want to hold some of those funds back for future needs. But I expect that after these surveys are done, sometime in the next couple of months, we'll start to see some expenditures, more expenditures from ARPA. Any other questions?
When it comes to the Rams settlement money, what's the status of that right now?
Yeah, we're talking with representatives. The questions about the Rams settlement, we're talking about representatives from the city. Our attorneys are talking, and the Sports Authority about what that might look like. There's no rush on that right now. We're all very busy trying to get the feedback from folks in the community about ARPA spending. And so we have lots of federal funds that we have to get out into the community. But I expect to have some movement on that in the next couple of months.
We've seen like open talks about ARPA money. When it comes to the Ram stuff, all of that's being handled behind closed doors. Why do you think it's a good thing that we're talking, multi-million dollars here, not being talked about publicly?
Well, the question is about the Rams settlement and the process for expenditures. What we're talking about right now with the Rams settlement is the proper way to divide that among the three plaintiffs in the lawsuit. We're not talking yet about how to spend the funds. We're not there yet on expenditures. When it comes time to talk about how to spend those funds, and that'll go back to the appropriating bodies, St. Louis County and the County Council and St. Louis City and the Board of Aldermen. So we're a bit of a ways away from a conversation about how to spend those funds. Right now, the conversation is the proper way to divide this settlement.
Do you think taxpayers should be involved in that conversation, though, about who gets how much?
The conversation in litigation generally involves the plaintiffs. The conversation in how to spend the money from the litigation will involve communication with citizens, for sure.
And then lastly, we recently had a council member calling for the Highway Patrol to do an investigation into Covet Walker's death. What are your thoughts on that? Do you think that's needed?
Yeah, so the question is about Core Faith Walker's death in the city of St. Louis last week. I believe the city of St. Louis Police Department is handling that. They're capable of handling that. The Director of Public Safety, Dan Isom, is a former police chief, well-respected and well-liked and fully capable of taking care of whatever needs to be done around this. This is a tragedy. Unfortunately, we're in a political season, and some folks will be political with that tragedy, but I think we just need to let the process work, let the city's medical examiner handle it, and if there's any law enforcement piece to it, which it doesn't look like there is anyway, then the city of St. Louis is perfectly capable of handling that.
Thanks, everybody.
All right, thanks a lot.